Peay, it's clear that we have a shocking situation in prisons. At least 10% with not just mental problems, but serious mental problems. Danger to themselves, danger to others. Let's say that's a given. What can be done about it?
I think one of the real difficulties is that there is a huge overlap between our definition of what constitutes people who have committed crime and what constitutes people who have mental disorder. And therefore there are a number of people in prison who will have both, by definition. And therefore, if you really want to do something about the state of the prison population, a number of people in there with mental disorder, what you really need to address is the prison population, not the issue of mental disorder, because if you were to significantly reduce the size of the prison estate, you would by definition take out huge numbers of people.
So it's a kind of subset of a bigger problem. The bigger problem is the prisons, is that it?
Yeah, absolutely. And, you know, if you look at the figures for last year, we sent getting on for 40,000 people to prison for terms of 6 months or less. So we're sending a lot of people on very short terms of imprisonment. And by definition, an awful lot of those will have mental health problems, which could frankly be much better treated in the community alongside dealing with their offending behaviour in the community, if only we had the resources in the community to deal with it.
There's 2 points there. There's one about resources and there's one about perception. Because the risk is, if a politician says, there's 2 people committed identical offences, one of them we're going to call mentally disordered, and they're going to get, as it were, the kind of Rolls-Royce treatment. They're going to be looked after in the community, we're going to acknowledge their symptoms, etc. And the other, who's merely bad, or merely unluckily brought up, or merely sociopathic, whatever that means, gets sent to jail. There's a difficulty there, isn't there? That it seems to reward certain kinds of offenders, as it were, for better treatment because of their mental incapacity. And that's something which victims don't understand.
That's right, but I think you're probably confusing what we might define as mental disorder. Mental disorder, as defined in the Mental Health Act, means any disorder or disability of mind, and therefore it includes all of those people with personality disorder whom the general public probably wouldn't necessarily associate with being mentally ill. And if you reduced your prison population, you would be reducing that population of people who are mad, bad, sad, who've had damaged and difficult upbringings, alongside those who are conventionally mentally ill in the sense that the public would well recognize.
Almost, give or take a few politicians, almost everybody shouldn't go to prison in a way. It's not just the mentally disordered, it's others, etc. Is this a kind of radical position you'd nearly get to?
It is the radical position to which I would nearly get. I think we need to very much restrict our use of imprisonment. We, by and large, imprison more people for longer than virtually any other civilised nation, except, of course, the States.
That's what the public want, or at least we're told they want it. And their politicians have not made this up. They're responding to what the public appear to be requiring. Punishment, punitiveness, victim statements. The whole grain of public opinion is towards this and not towards your ideal, is it?
Well, that's not actually true. If you look at the empirical evidence, when you present members of the public with much more information about the backgrounds of offenders, and indeed much more information about the possibilities of various kinds of intervention in the community, including community orders with mental health treatment orders attached to them, you find that the public are actually much more forgiving and much more understanding. And there has been a reluctance, I think, to inform people about what actually works and what they're paying for.
Francis Crook, who's involved in the Hard League for many years, says about the recent drift towards incarceration of mentally ill offenders, we are recreating Bedlam. Are we recreating Bedlam?
I'm not certain Bedlam ever went away.
Peay, thank you very much for subjecting yourself to the Gearty grilling.
Thank you very much.